I'm Dr. Joseph McAvoy. I'm a psychiatrist who works at the Medical College of Georgia. I've worked with individuals with severe mental illness clinically in clinical research programs, and it's been a great area of interest to me. It's been an honor to work with people in this area, and we're going to talk today about tardive dyskinesia, a side effect that has been around for a while, but now we have highly effective and very well tolerated treatments to manage.
And hi, I'm Dr. Andrew Nierenberg. I'm the director of the Dalton Family Center for Bipolar Treatment Innovation at Massachusetts General Hospital, and I'm a professor of psychiatry at Harvard Medical School. I'm delighted to join Dr. McAvoy today to talk with you about what's called tardive dyskinesia, which is a type of movement side effect that you may be able to, you may experience with some of the medications you're taking, and how to be able to manage it, track it, screen it, and collaborate with your clinician to be able to manage it.
So when we're asking someone like yourself about tardive dyskinesia, the kind of questions we're going to ask you include what you notice, your experience of movements of your face, your mouth. Some people feel their tongue moving around, their jaw going up and down. We'll move next to your arms, your fingers. And again, everybody's different in how they either see the movements visually or feel them. One person I work with noticed primarily soreness in her fingers because they were constantly rubbing the arm of a chair she would be sitting in. We'll ask you about your lower extremities, your legs, your feet, your toes. Some people notice that their toes are sore from rubbing on their shoes all day long. And finally, issues like rocking or twisting or swaying that represent involvement of your trunk and your core muscles. What we want to do is make an effort to boil it down to what's crucial for you, to individualize whatever tardive dyskinesia is. What are the movements that you notice? What are they like? Where are they located?
So like with all medications, they have benefits and risks. And this is the type of discussion you should have with your clinician, that if you're taking any of the medications that can be associated with tardive dyskinesia, those slow onset movements that you can have, you also have to consider, is it really worth taking the med, and are you benefiting from it? And if you're benefiting from it, and there's a risk of it, then it makes sense to be a partner in being able to evaluate it. That means part of the partnership is you can observe yourself and see if there are any movements that seem to be happening on their own without really your control. And that if you're able to observe that along with your clinician, then you can help screen for it, detect it, and then if in fact it happens, there are actually good treatments for it. So if it makes sense to continue the medication and you're having these sort of side effects, then you can talk to your clinician about what is it that you can do that will help it get better.
We're also going to ask you what your experience is of input from others. Does your family comment on the movements? Your partner or important others, co-workers, friends, do they notice or comment on these movements? And we will want to know, very importantly, is how does it make you feel when others comment on the movements? We'll want to know, do you at times try to manage the movements, to quiet them down, and what works, what doesn't work, and are there things that seem to make the movements worse? Are they worse when you're meeting a new person or having to give a presentation or some such stressful event? Can a lot of coffee make them worse? These sorts of things. Again, we're trying to get the story of your tardive dyskinesia so that when we're discussing treatment with you, uh, we want to make your tardive dyskinesia better. It's not what we assess of it. We want your life to be better, and we're very grateful nowadays to have treatments that are very frequently well tolerated and highly effective in making these movements better.
And the one thing I would add that in partnership with your clinician, it's helpful for your clinician to systematically screen you for this, to do a type of an examination that is systematic. And then from time to time, you can try to see, is this occurring? If this is occurring, is it getting better, staying the same, or getting worse? And then you can have a conversation about how to move forward.